Imagine your leg veins as a series of one-way elevators that are supposed to carry blood from your feet and legs all the way back up to your heart. Inside these veins, there are tiny valves that act like doors, opening to let blood go up and then closing to stop it from flowing back down. With chronic venous insufficiency, or CVI, these little valves get weak or damaged. It's like the doors on your elevators aren't closing properly anymore. When that happens, gravity takes over, and some of the blood that's supposed to go up to your heart starts to leak backward and pool in your lower legs. This pooling of blood can lead to a variety of symptoms, which often get worse over time if not addressed. Common symptoms you might notice include swelling, especially around your ankles and lower legs. This often gets worse as the day goes on or after you've been standing or sitting for a long time. Aching, heaviness, or tiredness. Your legs might feel tired, heavy, or achy, particularly after activity or prolonged standing. Varicose veins are, well, those visible, bulging, twisted blue or purple veins you might notice on the surface of your skin. The skin on your lower legs, especially around your ankles, could start to look discolored, often sort of brownish, and might feel itchy, dry, or flaky. Sometimes the skin even becomes thickened and a bit leathery. You might experience muscle cramps or an uncomfortable urge to move your legs, especially at night. In more severe cases, persistent swelling and pressure can actually lead to open sores on your legs or ankles, and these are often slow to heal. So, what can cause this to happen? There are several factors that can contribute to chronic venous insufficiency, including aging. As we get older, our veins and their valves naturally weaken. Genetics also plays a role. If other people in your family have chronic venous insufficiency or varicose veins, you might be more likely to get it too. So, spending long periods on your feet or sitting for a while can actually increase pressure in your leg veins. Carrying extra weight, like with obesity, puts even more pressure on those veins. And during pregnancy, hormonal changes and the increased pressure on veins can really contribute to chronic venous insufficiency. So, let's talk a bit about the history of blood clots. A past deep vein thrombosis, or DVT, which is basically a blood clot in a deep vein, can actually damage the valves in your veins even after the clot is gone. Is it serious? Well, while chronic venous insufficiency isn't usually life-threatening on its own, it can definitely have a big impact on your quality of life. If it's left untreated, it can get worse and lead to more painful symptoms, skin problems, and even leg ulcers that are tough to heal, which sometimes can get infected. What can be done? The good news is that chronic venous insufficiency is treatable and manageable. Your doctor will probably recommend a mix of lifestyle changes like elevating your legs, regular exercise, and wearing compression stockings, which really help your veins pump blood back to your heart. Depending on how severe your condition is, other treatments like medications or minor procedures might also be discussed to improve blood flow and help relieve your symptoms. If you're experiencing any of these symptoms, it's honestly a good idea to talk to your doctor so they can properly diagnose your condition and discuss the best treatment plan for you.